almost half of healthcare staff working in intensive care units (ICUs) through the COVID-19 pandemic in England could be suffering from problem drinking, severe anxiety and post-traumatic stress disorder (PTSD). New research from scientists at King's College London and University College London suggests, highlighting the mental toll shouldered by health workers fighting the virus. COVID-19 has exacted a heavy mental toll on a vast number of people in the US and the UK, with many warning of a silent mental health pandemic running alongside the coronavirus pandemic. Isolation, stress and fear of the virus affect everyone, especially as lockdown measures are put in place, but those working to tackle the pandemic directly face a unique set of stressors, highly challenging work environments and long, high-pressure hours. The British study adds to a growing mound of evidence warning of the significant psychiatric risks the pandemic poses to frontline workers as well as survivors of the disease. A recent survey from Mental Health America showed 76% of healthcare workers reporting burnout and exhaustion. NPR reported on nurses in LA quitting as hospitals are stretched to breaking point. The study relied on self-reported questionnaires, so we don't know the true extent and validity of these reported symptoms. Further work is needed to better understand the real level of clinical need amongst ICU staff, as self-report questionnaires can overestimate the rate of clinically relevant mental health symptoms, the scientists said. COVID-19 survivors are also at considerable psychiatric risk. One study found that 1 in 5 patients was diagnosed with a mental illness within 3 months of testing positive. Puzzlingly, the researchers also found that those with pre-existing psychiatric illnesses were 65% more likely to contract COVID-19, a finding researchers said needed further investigation. The COVID-19 pandemic is causing more severe mental health issues, and more burnout among psychologists and psychiatrists. Forbes, 1 in 5 COVID-19 patients diagnosed with a mental illness within 3 months of testing positive. Study finds. Forbes, full coverage and live updates on the coronavirus.